My name is Junior Hado with Funk Physiotherapy. Today we're talking about the MLS laser. One of the things that we get asked about a lot about the MLS laser is how does it actually work? So we're going to do an in-depth look, at least give you like a good understanding of how our body works in recovery to understand how it works as a laser and therapeutic modality. The lasers come in either low level, meaning that using a laser pointer, no physical damage, versus a high level, which could probably tear down the entire world. And MLS is going to be somewhere in between. MLS, what it stands for, is a multi-wave lock system, meaning that it produces two types of waves, one being continuous, one being pulsed. And a continuous emission means when the laser is turned on, those waves keep constantly firing from the laser. And versus pulsed emission, what it means is that it will send those waves, stop a little bit, and send them again in a repeated pattern. So that's how MLS first started, by combining those two waves. So you may be thinking, okay, Junior, that's great information. I know what MLS stands for, and now I know what wavelengths are and stuff like that. But what does it mean as a patient? What is it going to do for me, right? And that's a good question, because behind all that science, there has to be something that actually is practical. What I want to explain is that the way that this laser works is that it provides a good therapeutic effect without actually causing any type of burning on our skin. Lasers have been used for a long period of time in the setting of physical therapy to provide a therapeutic effect, but now MLS provides you with a more accurate and a better results as well. So I'll go and explain. We as clinicians, we as individuals who help you with the recovery process don't actually do the healing. Your body does the healing itself. What we do is we try and facilitate it through different ways, and we're trying to make sure we're trying to make that recovery process occur a little bit faster and a little bit more efficiently. And the laser is no different in that sense. Now that we know that energy is required for cells to, create new cells that are good cells and take away the bad cells that are injured cells, what that means is it has to come from somewhere. Now, this may shock you, but all the entire energy on this planet comes only from one source, and that source is the sun. What I'm using right now to record myself, the light, everything in this clinic that's running right now is all because of the sun. You using your cell phone or watching on the computer or tablet, that's coming from the sun. And our energy from our body comes from the food, and that comes from the sun as well. So everything in of itself coming from the sun. And just converted in different forms. If you don't believe me, ask Sir Isaac Newton, smart guy. Anyways, going back to our topic. So now that we know that the energy comes from a light source, what if we can actually concentrate that light source to help proliferate, or how to make it faster and more efficient in the recovery process? And that's where the laser comes in. As I previously mentioned, one of the things that the body needs is what's called adenosine triphosphate. And when we have that, our cells, our entire body is able to move and function a little bit better. So once those cells have the ATP that is required, that means that the system, so let's say the circulatory system, which is your heart, which is your veins, which is your arteries, are able to work a little bit better. So by increasing the amount of ATP in the cells in that circulatory system, may actually increase the amount of blood flow to the area, which brings in nutrients and oxygen and helps with the recovery. So once you get things going on the cellular side, that actually creates a bigger effect and helps you with the recovery process. So that's just one example, and the MLS laser is not only able to help with the circulatory system, but as well as the nervous system and the musculoskeletal system as well. So all those things working together helps you create a better and probably a faster and more efficient recovery process. So a lot of patients ask me, will it work for certain conditions or not for other conditions? In general, if you have an injury, MLS laser will work pretty good for you. The reason why is if you look at the cellular level, whether it be arthritis, whether it be shoulder pain, whether it be neck pain, degenerative disc disease, whether it be nerve pain, if there is damage to some sort of cell, the MLS laser will be able to provide the energy or provide the light energy that it needs to produce more ATP to help with the recovery process. Now, I don't want you to think that the MLS laser only provides you with extra ATP, because what it does is other things as well. And if you want to read the entire science of it, I'll put the link in below, and then you can read all the other things that it can do as well. But I'll probably say that's probably the easiest, probably the most simplest way to think about it. Your body needs extra energy to facilitate that process, and it comes from light, and therefore the MLS laser can provide that light. Since all injuries require some damage to the cells and need further recovery, and speed of recovery is always good, the MLS system can help with any type of injuries that you may be thinking about in a physical therapy setting. So I'm just going to list them here, and you can take a look, and you might be thinking that's pretty much everything that's in the physical therapy setting. The other question that we get asked a lot is the MLS laser safe to use? And the answer is yes. The FDA has approved it of 85 to 90% efficacy rate for individuals with any type of pain as well as inflammation as well. So what that means is for most people, 85 to 90%, if you have some sort of pain or inflammation in the area, this is a very good solution for you. For those individuals who don't fit into that 85 to 90%, we want to make sure that we provide other resources and other things as well to help you with the recovery process. So this is the MLS laser. As you can see, it looks very futuristic, looks very cool, and it looks like one of those lasers you might see in a movie from the bad guy. But it's not, so don't worry. One of the things we want to take a look at here is once you come to the screen, it's going to have various settings as well. It's back pain, cervical arthritis, hand-foot pain, and if you keep going, you can see that pretty much it covers everything that you probably want to. Sorry, my finger doesn't do that well. Strain, tendinitis, keep going, tennis elbow, trigger point, peripheral neuropathy, pretty much everything that you can think of, there's a setting as well. And if it's not in there, we can always program it. So let's just pick one thing as well. Let's just pick sciatic pain. So once I pick that, we can press enter, and as you can see, it's already turned on. So let's take a look at what it looks like. I don't know if you can see there's that red mark right there. So that's the area, that's where it's going to be concentrating based on the X and Y axis. So if you want to make it a little bit bigger, a little bit smaller, that could be changed as well. But now let's take a look. So as you can see right here, to make the adjustments, let's see if my camera focuses. Ooh, maybe not. Maybe I'll go a little bit further back. There. You can raise the head and lower the head so we can raise it up. Now that it's higher, good. Let me press that again. It raises up and it can go down. Good. And from side to side as well. The machine will go up and down in various ways too. So based on that, once we press start, that means the laser will begin. And let's just take a quick look. So it's starting right now. It's going to run technically for about 12 and a half minutes. And when it does, as you can see right here, the laser will be concentrated on that area. So let's press start right here. And there you go. Then the laser will get going, and between the X and Y axis, it'll be concentrated in our fake patient right now. So I'm just going to stop it since it's not being used. So stop. And then once it's done, boom, the light turns off as well. So that's the MLS laser. The last thing that I want to emphasize today is that therapy does not happen in a bubble. What that means is that this one thing, let's say the MLS laser, will not be able to help you with all the problems that you're having with your shoulder, your back, your neck, whatever it is. It's only one part of the solution, and it's going to be something that we want to facilitate other parts as well. So for example, let's say you have shoulder pain and you have trouble reaching the top shelf. So that is an introduction to the MLS laser that we use here at Funk Physiotherapy. If you enjoyed this video, please remember to like it, share it, also subscribe to our YouTube channel. If you are on social media, please make sure you follow us on Facebook as well as Instagram for more great content. My name is Junior Hada with Funk Physiotherapy here in New York City. I'll see you on the next video.